Hi everyone and welcome back to my channel. I hope everybody has had a great day. So in today's video I want to talk a little bit about a popular question that comes up a lot in my sessions, and that question is, what is the difference between counselling and CBT? So counselling and CBT are both therapies for mental health difficulties, and usually when we have a client come into therapy, seeking therapy, we will do an assessment, and then at the end we'll determine what is the best course of action. And that may be CBT, it may be counselling, it may be one of these other therapies like IPT, DIT, or it may be something else altogether. But today I'm just going to focus on the two modalities, which is CBT and counselling. So most counsellors are trained in something that is called psychodynamic counselling. So I will talk a little bit more about that today and what that is as well. And then, yeah, I'm just going to explain to you guys what is the difference and why a patient or a therapist would choose CBT over counselling or counselling over CBT, right? So let's kick it off. So one of the main differences between CBT and counselling is the kind of focus of the treatment. So in CBT, it is very kind of goal focused or goal orientated. So right from the very beginning, we will be asking you guys, what's your goal? What do you want to change? What are you trying to achieve in the next couple of weeks, next couple of months, next year or so? So then we can basically start creating a treatment plan. So as I said before in previous videos, it's a bit like having a PT for the gym, but this is a therapist for your mind. And we're going to create you a plan, we're going to set certain tasks, which we call homework tasks or action plans, and it is up to the client to then go away and practice those exercises. Now, alternatively within counselling, that is not necessarily the focus. So, some counsellors may work in a more kind of goal-focused way, but generally the kind of idea of counselling is more to be a safe space to openly talk about things and have a safe space to maybe process some of those things that have happened. So, that's maybe why we might have like relationship counselling, right? To process the relationship patterns and to get some support with that. Or maybe we might have sort of bereavement counselling, to talk about the loved one that we've lost and the process of grief and that sort of thing. So yeah, I would say that is sort of one of the main things. So CBT is more goal focused, there's going to be homework to do, whereas counselling is more a safe space to talk and kind of process your feelings. Now, it can get a little bit confusing, right? Because with CBT, of course, we do talk about things and we may ask you a little bit about certain situations. However, the kind of goal behind asking those questions is for the CBT therapist to pick out certain thought patterns and certain behavioural patterns that the client is experiencing, and then think about what kind of CBT tool can be practiced to break out of any unhelpful thinking patterns or unhelpful behavioural patterns, whereas a counsellor may not necessarily do that. Right, they may feed back to you what they've said, or maybe they might encourage you to do a little bit of role play, or they might ask you a little bit more, well, what did you really feel about that? Or when you were talking about that, what did you notice you were feeling? Whereas they might not ask you, what it is, that maybe you want to change. So maybe the client is ruminating on something. So the CBT therapist would notice that pattern of rumination, and then we would start to think about what strategies can we implement to kind of break out of that. A counsellor might not necessarily do that. Right, they may talk a little bit to you about your experience, but they might not necessarily set you like a specific exercise like a CBT therapist would. So when we are trained as CBT therapists, we are trained in a certain way to be able to ask certain questions to find out what the symptoms are, to look at the thought and behavioural patterns, then to set a specific homework task, and then the kind of end part of the therapy session will be discussing that homework task, planning it and sending you away to practice that. Now, I am not actually trained as a counsellor, so I've not done that training. I've not done sort of psychodynamic counselling. However, I have had counselling myself with a psychodynamic counsellor. So I know everyone's a little bit different, but I do sort of know a bit about how it works. And it's definitely not as structured as a CBT session can be. So I guess when I'm assessing clients as a CBT therapist, I am thinking in the back of my mind, you know, are there any patterns here that we could maybe work on in CBT? If not, maybe counselling might be better. And then I'm also listening to what the client is saying to me. You know, if the client is saying to me, you know, I've not spoken to anybody about this and I just feel like I've got nobody to talk to, and then in their goals they are saying they just really want to talk about it, you know, they're not necessarily looking to change themselves or change anything, but they would just really love somebody to listen to them and, you know, maybe feed back how they're feeling, normalise their feelings, etc., etc. In that instance, I would probably be thinking this client is more suitable for counselling. You know, they may say things like, you know, I've just really not got over that situation that happened with my friend 6 months ago, and I really want to talk about it. Or maybe they're saying, you know, I've just not got over the loss of my dad, and that was really, really hard for me, and so maybe some bereavement counselling would be best. If I was to give you an example of maybe a CBT situation, you know, maybe I might have a client that has got social anxiety and they are saying to me that they've just finished uni and they're about to apply for new jobs and they're going to have interviews coming up, and this just makes them really anxious and they tend to avoid these things, or maybe they over prepare going into interviews, or maybe they just try not to think about it until the moment. And so I would be thinking with this client, you know, they really need help with their anxiety, they need help with their behaviours, so maybe they need to reduce the perfectionism, or, you know, maybe they need to practice actually because they haven't had many interviews, so you could practice with them as the CBT therapist, or you could encourage them to you know, make a bit of a plan and maybe practice in front of other people. You know, there's loads of things that you could do there to change the behaviours, and also you could help them changing the thoughts, because they're probably going to be having a lot of negative thoughts about the interview and what they might say and how that might go. So you could do some thought work there as well. So, you know, it can be a little bit tricky sometimes because we may not know until we start. So we might start the CBT and think that we want to work on some goals, but then we're like, oh no, actually I haven't processed this, and we might need to swap around, or vice versa. Maybe we go to counselling and the client is then realising, oh no, I actually do really want to change these behaviours or thoughts, so I do need a CBT therapist. And you know what, if that happens, that is absolutely fine. You know, just because you try one option doesn't mean then you're blocked out of the other option. You know, you can swap around to different modalities. The only thing I would say is I wouldn't recommend having two therapies at once, or two modalities at the same time, because it might be a little bit conflicting. You know, one therapist might be saying one thing, one therapist might be saying another thing, and I don't know, I feel like you might just get overwhelmed with having too many. It probably is best to focus on one treatment with one therapist at one time. I mean, the only time that I would maybe allow for having two therapists is if, say, you was working on completely different things. So let's imagine you are having relationship counselling specifically to work on things going on in the relationship, but then you was having CBT therapy for a phobia. You know, let's just say emetophobia, which is a vomit phobia. They're probably not really connected. So you're not going to get confused with that treatment with that treatment. You know, that therapist telling you one thing, the other therapist telling you another. It's just not going to happen because you're working on completely different topics. So in that case, I may allow it. Or let's say, for example, I'm working with a client on some mental health difficulties, so maybe they have some general anxiety, maybe some social anxiety, some eating problems, this kind of thing. I can work with them as a CBT therapist, but maybe they might be having a treatment elsewhere for an alcohol problem, let's say. Now, if the alcohol problem is not so severe that it's not impacting their cognitive function and they can engage in the therapy, then that's okay. They can go to maybe a service called CGL, where they can have their treatment. I think sometimes they do group treatments as well as one-to-one. But anyway, they could have the treatment focusing specifically on the alcohol intake and reducing that, as well as having the CBT therapy. But it does depend on the severity. So, you know, if a client is really struggling with addiction, they're having a lot of binge drinking, they're drinking most days, more likely than not, it's going to be affecting their cognitive function. And in order to engage in CBT therapy, it does take quite a bit of cognitive function, you know, making sense of things, talking about the tools, understanding the homework task. So if a client is not able to do that, it may be best that actually they go to the other treatment centre, they have their treatment, you know, for the alcohol problems to get that under control, and then they can come back to us for the CBT therapy. Hopefully when they're feeling a bit better, all the alcohol's out of their system, their cognitive function's a little bit better, then it's more likely going to be more effective. And I think the reason we do this is because we understand that sometimes they might be very intertwined, right? And so if someone's got two problems at the same time, I mean, it may just mean that they're suffering longer, right? If they're not getting both of those problems looked at once. But yeah, as I said, sometimes it is maybe just not possible because, you know, it takes a lot of effort as well to engage in therapy. So engaging in that too could potentially be a bit challenging. So I'm trying to think now, was there anything else? Oh, there was something else that I wanted to discuss. So another thing that you may want to think about with counselling, particularly with psychodynamic, is they do like to talk a little bit about your childhood, you know, quite often about past experiences in depth, and they will try to sort of make links between those past experiences and what happened in childhood to now. So they might ask about your family life, your parents, your siblings, what they are like. Is there any history of mental health difficulties? You know, what other experiences did you have at school, with friends, etc. So we can try and make these links. Now, we do that a little bit in CBT. We do something which is called a formulation, which is just a technical word for like a map, basically. So let's say somebody does have a current problem. I would maybe discuss with them, you know, was there anything that happened in the past that may explain why you're maybe thinking or feeling like this now? And we will map it out, and we might write it down and you know, put it on paper or put it on a Word document so that we can see it really, really clearly. But one thing I would say is we don't usually talk in a lot of depth about those problems. I'll give you an example. Now, let's say I am working with a client who is really anxious about dating, and let's say it's a female and she gets really anxious about dating males. When we talk about it, maybe she's had some early experiences which may explain why she struggles with those interactions. So maybe when she was in primary school, maybe she was bullied by a man, or maybe in her teenage years she had some difficult romantic experiences. Maybe there was a little bit of domestic abuse, you know, maybe some physical, some verbal abuse. And sometimes these experiences can really affect how people see the world and see other people. So thinking about that, we can think, oh, okay, well, now it sort of makes sense why you have this anxiety because of this if we look at your history. But then what we would try to help the client see is that that was the past, and actually here in this very moment it's not actually connected with that past experience. So we try to help them stay quite grounded and use kind of like mindfulness tools and things like that to really stay in the present and look at things as they are, rather than sort of being influenced by things that have happened in the past. So we look at kind of thinking styles, and we may use a bit of an analogy, which is like, you know, sometimes when people have negative thoughts in the here and now, what's actually happening is they're not seeing it in the moment as it is. It's almost like they've got these sort of tinted glasses on, and they're viewing it through the lens of those glasses. And those glasses, right, are shaped by our past experiences. And, you know, they could be negative, positive, but especially if somebody's experiencing depression and anxiety, it's probably going to be negative. And so the saying that we would use in CBT is like, what we're going to try and do is take off those glasses and really see the situation for what it is now, right? And then we'll make a judgment about that situation, whether it's safe, whether it's not, whether we need to do problem solving, whether it's okay. But hopefully it's not being influenced by our past experiences. So, you know, that's how we would look at it in CBT. And it's quite quick. You know, sometimes if a client does want to talk a little bit more about it, we will set some time there. You know, we don't just want to quickly brush over it, especially if it is something that's been quite traumatic. But we don't want to linger too much on it, because we don't want the client to ruminate on it. And as I said, the goal of CBT is not necessarily processing. It is, you know, setting a goal, making a plan, and following on from that. Whereas from my understanding, the counselling is a bit more of a safe space to really talk through things. You know, I imagine the counsellor would ask a lot of questions, you know, well, what happened then? What happened next? Well, how did you feel when that happened? And can you remember anything else? Trying to sort of jog that memory. And it might just be that some of those thoughts and feelings have been like buried down, or maybe clients have tried to suppress them. So the counsellor is going to want to bring all of that up and bring all of that out to really look at it. So how I describe it sometimes, it's a bit like a Pandora's box, isn't it? And sometimes if we're experiencing low mood, it's that we try and, you know, keep that lid on that box, and, you know, we don't want to look in it. But it is buried under there, right? Affecting us maybe subconsciously. So, you know, what your counsellor may do is ask you to open up that box, which probably can be quite scary, but, you know, I can see how it would be really effective as we're opening it up, we're looking at everything, we're taking it out, we're, you know, reflecting on it, we're talking through it with somebody else who is hopefully comforting us, you know, normalising our experience, you know, possibly relating and, yeah, normalising it. And then hopefully once we've took it all out and we've looked at it, hopefully we will feel better. Now, I would say one of the downsides of maybe having counselling and not having CBT, or maybe having counselling first, is that you may take all of those things out of your Pandora's box, you know, all of your traumas, all the things that are bothering you, all of your triggers. And yes, it may be helpful having it out there in the air, but then if you don't have any coping strategies to manage your emotions or regulate your emotions, you may find it difficult, right? So when I'm kind of referring somebody to counselling, I want to make sure that they do have, you know, a little bit of resilience, and that they've already got some coping strategies, because potentially some of the things that you're going to be talking about is going to be difficult. It could be very upsetting. Also, if you do remember something from the past that is really upsetting and triggering, you know, if you've got unhelpful coping strategies, I'm thinking, you know, excessive alcohol use, drug use, comfort eating or not eating and starving yourself, then there may be more of a risk of these things happening, right? Because these, even though we know they're unhelpful, these are behaviours that people are doing to try and soothe themselves, or to like maybe regain some sort of control. So yes, if you're struggling with those things, it may actually be better to work with a CBT therapist to work on those patterns, remember those vicious cycles first, so that when you do go into your counselling, you know, hopefully you are going to have that processing, and your emotions are going to sort of regulate. Because if you're really dysregulated and, you know, engaging in those unhelpful behaviours, you may actually end up feeling worse. And, you know, nobody wants that. We don't want that. I don't want that. So we want to be really careful with that. Sometimes when I work with clients, you know, they might have had CBT already, or you know, they don't want that kind of goal-focused treatment at the moment, and they might be very adamant that they want counselling, which is fine. But again, if I notice that there is a risk that you may become dysregulated or you may not be able to cope with it, I'm usually quite assertive with that. You know, it's still your choice at the end of the day. Like, no therapist can make you do something that you don't want to do, or do a treatment that you don't want to do. But I will, you know, just give you the heads up on that. Because you don't want to be in a situation where you started your therapy and then you have to stop it, or your therapist has to refer you to another service because you've got worse. So it may even be that you just have a couple of sessions, right? You might just have 4, 6 sessions, something like that, and then you're ready to go to counselling. But yeah, I think that's just something to be mindful of. So I think that's the main things that I wanted to mention today. You know, really, that counselling is more of a safe space to talk, whereas CBT is more goal focused. We're picking specific things and we're looking at working on them, we're looking at changing them. And that, yes, maybe counselling is a bit more to do with that kind of processing, looking at things that have happened in the past, talking about them at length, in depth, a little bit like opening that Pandora's box, whereas CBT is not necessarily so. We may not go into as much depth. And some clients might actually like that, actually, particularly with like PTSD and you know, trauma related things. Sometimes clients, they don't want to go back there, you know, even though maybe they're having the nightmares and flashbacks. So actually, you know, having an hour talking about it, you know, it could be re-traumatizing. So they would actually prefer just to give you the headline, and then what we do is we look at things like your sleep, and again, like giving you specific tools to manage the symptoms without having to, you know, go into your deepest, darkest memories, right? So yeah, and I guess CBT therapists, we are trained in a certain way to be able to do that. So to manage the treatment session, to, you know, ask certain questions, to make sure there's enough time at the end to set the homework task, and that the main part of the session has been spent discussing that tool with the client. So then you can agree on the homework task. You know, we don't just pick tasks randomly and set you random tasks. They are specific to you. Whereas the counsellor is more trained to, you know, sit back a little bit and ask you questions about your feelings and, you know, what went on, and maybe try and help you remember a little bit more, or to help you with processing those feelings. So I hope that has been helpful, guys. Let me know what you think about it. Would you agree with what I've said today? Is there anything else that you would add? You know, are you a counsellor and you can provide a little bit more insight into your treatments and how it's different from CBT? If so, I would love to hear from you. You know, definitely pop a comment in there. What about you guys, you CBT therapists? You know, are you different from me? Do you spend more time talking to clients than the homework? You know, are you able to keep your sessions on time? I know I can struggle with that sometimes. You know, it takes a bit of practice, like trying to get everything in the one session with the CBT session. Are you a patient who has had CBT or counselling, and did you want to drop me a message and let me know what your experience was, what you liked, what you didn't like? You know, have you had both, and what was your experience of them? So yeah, I would really love to hear from you guys. You know, I love chatting and about all things therapy and wellbeing related. And yeah, I hope you have a really good week. All right, take care, guys. Bye.